Dr. Swapnil Avinash Gawande, sir.
Thank you very much, ma'am, for such a nice intro. And basically, I thank to all the organizers, the panelists, and the especially to the Ayurved Teachers Association to inviting me for on this special and great platform to share my views on the recent advances and in the Ayurveda, how we can integrate the Ayurveda with the AI for giving our patients the better way. It is, I'm to be very frank, I am a little bit nervous because I am sharing this on the platform where all the great teachers, where all the educators of the Ayurveda are in front of me. So I will just try to lit a lamp before the sun, but I will try to share the best of the practices which I have doing from since last 15 years. So not taking you much of the time, we'll move to the topic directly. So the integrated management of neurological deficit in the spinal disorders. So the basic four things we are going to cover in this seminar or in this talk. The overview of the spinal disorders, Ayurvedic approaches and spinal disorders, COX or the flexion distraction or the spinal decompression technique, and the role of AI in managing the spinal disorder. And no doubt, this all with the integration of Ayurvedic principles. So let's start with the first topic, the overview of the spinal disorders. So as you all know that there are the two basic reasons for the neurodeficient. One coming from directly from the brain or the neurological system, and the second, the mechanical defaults or mechanical deformities into the spine. So in this topic, will be basically focus on the neurodeficient, which are caused by the mechanical disorders of the spinal cord and the spine. As you all know, I will cut short some of the part that there are main three types of the things which are the mechanical deficit we find in the spine. The first is the herniated disc. Herniated disc occur when the inner gel like core spinal, that is the nucleus pulpus, protrudes through a tear or a tear of outer level, which we call as the tear or the annulus. Then causing the pain, nerve decompression, and the nerve compression and the limited mobility. So, herniated disc basically are the protrusion of the nucleus pulpus into the annulus. Then the second is the spinal stenosis, which is the most common thing we can find. That is the spinal stenosis is the narrowing of the spinal canal, which can lead to the pressure on the spinal cord and nerves, resulting in pain, numbness, and weakness in the limbs. Then the spondylosis, which is the very common or the commonest finding, or you can say that around in the general practice, around 30% of the patients come with the low back pain. So the spondylosis refers to the age-related degeneration of the spine, including arthritis of the vertebrae and intervertebral disc, leading to the stiffness and chronic pain. So basically, we have to see that when looking the patient clinically, if the patient is having the limited mobility or the SLR positive, then there is acute herniated disc, we can say. When the patient is complaining about the continuous numbness or the weakness or the quad equina syndrome or claudication like symptoms, then it may be a spinal stenosis. And stiffness, chronic pain, or dull pain like system or the morning stiffness, there might be the spondylosis. So these are the main three types of the deformities which we find in this mechanical spinal disorder. So neurological deficit associated with the spinal disorders, as I discussed earlier. What are the commonest symptoms and diagnosis? The neurological deficit may be manifest as a pain, weakness, or sensory loss, requiring thorough clinical evaluation, diagnostic imaging, identifying underlying the spinal condition. So these neurological symptoms are present, which we call the like numbness or claudication or the paresthesia. Then these symptoms impact the quality of the life of the patient. So spinal disorders significantly affect the daily functioning, often causing the chronic pain, reduced mobility, emotional distress, and thereby decreasing overall quality of life of the patient and also his performance at his workplace. Then what are the current challenges? The clinicians face various challenges, including accurately diagnosing complex spinal disorders, managing pain effectively, and providing tailored treatment. As some of the panelists said that yet that pinde pinde matir vinna, which is our basic trend that every body, every person, every patient is a different, and his problems are also different. So we have to give the tailor-made solutions to our patient, and that is the biggest challenge nowadays. Because the patient needs are diverse, as Madam said in my introduction, that I am dealing with the sports personalities. I have also some of the challenges that if somebody comes to me with a, for example, I am treating mostly the boxers or national and international boxers who are playing for India. They came to me, sir, I have a bad spasm in my back, or I have a bad low back pain, and I have to play tomorrow. That is the need. I can't say him that okay, don't play tomorrow, because that is he is playing tomorrow, and for that tomorrow he has prepared for tens of years. So we have to address such kind of needs nowadays, as we are working in today's era where everything is moving fast. Everybody has to travel for some or the other reasons, and it will become now the very challenging thing to ask the patient to take the rest for a particular period. Then this is the overall. I will not go into the depth. I will just tell you that majorly there are two types of mechanical spinal disorders. The one is the nerve root compression, and the second one is the cord compression, or the cauda equina syndrome, or the cauda equina. These are the broad spectrumly, these two mechanical problems happens into the spine. Like the exiting nerve root compresses at the level of the facet joints, or at the fissure where from where the nerve exits from the spinal cord. And in cauda equina syndrome, in particularly into the posterior disc bulge, it compresses the spinal cord. And we have earlier slides we have seen what are the impact of these two different. Generally, in it may be unilateral or bilateral. The symptoms may produce unilateral or bilateral depending upon in which directions the disc has been protruded or herniated. Then coming to the Ayurveda approach of the spinal disorders, that we have seen overall scenario of the spinal disorders. Now coming to the Ayurveda approach, or how we can balance the spine wellness with the Ayurveda. So basic principles of Ayurveda are the dosha imbalance and its role, detoxification technique, which we call the Panchakarma or the Shodhan Chikitsa, and the herbal remedies and treatment, that is the Shaman Chikitsa. So understanding the three doshas, Vat, Pitta, Kapha, and its essential Ayurveda and imbalances can lead to the various spinal disorders, and identifying these imbalances helps to formulate the personalized treatment plan. So as we all come from the basic background of the Ayurveda, so every patient should be addressed first with the dosha parikshana or the prakriti parikshana, as the session or the whole conference is based on the innovative techniques. So we can take the benefits of the nowadays, just like the chairperson ma'am is also developed the Nadi Pariksha through the AI apps and the Android apps. So we can use to identify the basic dosh drushti, and during this we also have to be very precise that the dosh drushti is antarik or bahya. For example, the dosh drushti may be the anti-aging, the aging is one of the reason, and the nutrition plays a vital role in the spinal health. But along with that, aghat or the fall or accident can also cause the mechanical disorder. I would also like to share that when it was a research, the number one cause for the disc degeneration in the world is vibrations. And you all know that the most common reason for the vibration is our traveling. And now people are traveling more than in any era. So that is the one of the reason. It is the, and in Ayurveda, the it is already explained that the pravas or the gati causes the vata, it procops the vata. So we have to also look for the lifestyle to balance the dosha. Then, no doubt, I think that it is not to explain that what is the importance of the Panchakarma therapies in managing the spine. So we have to also focus on the uh, like Rutu Shodhan and all that things for the sustainable spine solutions or the sustainable results, sustainable pain management. Then herbal remedies, Shaman Chikitsa, all are the practitioners and the students are also nowadays are very much doing efforts to take the knowledge of the Ayurveda remedies and herbs. We have good companies, we have good R&D in the R&D going in the field of Ayurvedic medicines. So we have to take the all these three in consideration while treating the spinal disorders. Then integrating Ayurveda with the Western medicine is one of the thing that some people call it as a mixopathy, or we have to use sometimes the allopathic medicines or the modern medicines while treating the patients. So collaborative treatment models we have to develop. Then case studies, successful integration and addressing the skepticism and acceptance. So rather than fighting amongst the pathies, or rather than fighting amongst the principles or the philosophies of different systems of medicines, we should try to integrate for the betterment of the patient or for the betterment of the society, because nowadays it is becoming endemic situation of the osteoarthritis or the lumbar spondylosis is becoming the endemic situation now. So we should have also consider, we should as the already the conferences of the Ayurveda teachers, so you people, you educators are doing a great job by researching on the different fields, by publishing the various articles, the research articles, case studies nowadays are going in Ayurveda, and that should be done on the more robust situation and in the most robust collaboration of the educators and the practitioners. Then we will speak now about the spinal decompression. As you know that the spinal decompression is the reason that the disc is compressing. Sorry, the vertebrae are compressing the disc because of various reasons. It may be spondylosis, it may be spondylosis, it may be spondyloarthritis, it may be adhatjanya or accidental. So just see that how the modern decompression techniques, modern decompression techniques can be integrated with Ayurveda. So robotic spinal decompression is what I want to elaborate today on the more. So first of all, we will see the mechanism of action of the robotic spinal decompression. This technique employs a specialized spinal decompression table that creates a distraction force in the spine, relieving the pressure on the intervertebral disc and nerves, promoting the natural healing and process. Definitely, when the disc is compressed between two vertebrae, it will be less place for the circulation. It will be less uh, disc space to move or the function the disc naturally. So when we decompress it or when we distract it, there is a difference between traction and distraction. Traction is unilateral, but when distraction is bilateral. So we are distracting it from both the side, and it promotes the healing of the disc, like the disc degeneration, disc dehydration, then disc nutrition. It provides the nutrition to disc when we decompress it. So this is how it helps in nutriting the disc, then allowing it to function naturally, allowing the disc to be in its natural range of motion. Then what are the indications for this robotic spinal decompression? This technique is commonly indicated for the conditions like herniated disc, spinal stenosis, and sciatic pain, as it offers a non-invasive option for patients with debilitating spinal issues. So it is a non-invasive, indirect technique of distraction where we are not actually doing any surgical thing or any intervention, or we are not disturbing the core area of the spine. We are just separating the two vertebrae apart and allowing these to function its nutritional and physiological and anatomical functions naturally. Then how we can select the patient for this technique? So patient selection criteria is that the ideal candidate for this technique typically possess the symptoms related to disc herniation, are not surgical candidates, and have no contraindications such as severe osteoporosis or the malignancy. Because when we do, if there is a tumor or there is a myeloma or like that things, and we try to decompress it, it may increase the pressure on that particular structure and it may hurt more. So all the patients who are being affected from the herniation or the spondylosis, spondylolithiasis, and spondyloarthritis are the eligible patients for the robotic spinal decompression, where we have produced the numerous patients. I'm happy to share that since last 8 years, I'm using this technology, and more than 3,500 cases we have successfully treated, and only 6 patients needed the surgery. Out of 3,500 cases, only 6 patients needed the surgery despite having a robust decompression techniques and Ayurveda treatments. So I think that it is a great number of, it is a very small failure when we divide 6 with the 3,500 cases. Then what we can expect? What we can expect as an outcome? I'm not saying results. I'm saying outcomes, because results are not in our hand, and I politely say that we should stop speaking or we should stop verbalizing this word results, and we should, if we want to develop Ayurveda, if we want to stand Ayurveda, we have to also change our languages. Like, we should call it a clinical outcomes, so that it will give us a more authentications. It can give the more confidence, because what is the main issue which I have faced in early days of my practice, that in Ayurveda it is very difficult to reproduce the results. So reproducible results are the main challenge among the Ayurveda physicians, Ayurveda Vaidyas. So with this technology integration and with this type of thing, we can produce the reproducible results. So first of thing, clinical, it is a evidence-based. Recent studies now substantially improvement in the pain relief and functional mobility among the patients undergoing this technique, with a high success rates noted in the both short and long-term evaluations, as I have said earlier. Then long-term benefits, patients often experience prolonged relief from the symptoms, reduced reliance on the pain medications, and improved quality of life, indicating the technique's sustainability and the effectiveness over the time. As in Ayurveda, we say that apunarbhav chikitsa, so it is providing both the acute, chronic, and apunarbhav chikitsa in a single integration of Ayurveda with this technology. Then patient feedback and satisfaction. So the feedback, surveys from the third parties, surveys from our own clinical practice, and also on the international platform, the feedback surveys for the patient reveal high satisfaction rating, with many reporting significant pain reduction and enhanced ability to perform daily activities. So this is how what outcome we can expect when we are going to integrate this technology. So now coming to the both, first we have seen the overview, then we have seen how the technology, what is the philosophy behind the technology, and now we are going to see how we can integrate it actually practically in our clinical practices. That is the integration of Ayurveda with AI in managing the spinal disorders. So these are what the actually, because as I am not an academician, so please excuse me if it is something in not in a proper manner. But this is what the protocol we have developed over the last 8 years of practice in integration and diagnosis and assessment. So predictive analytic, we are the best at predictive analysis, what I think, because we have the strong tool like Prakruti Pariksha, then Dhatu Saratva, then the postural analysis through AI apps. Definitely, I'm going to show some slides also. So Prakriti Parikshan, as every Ayurved Vaidya does, then Dhatu Saratva, we have to focus more on the both the things, like what is the Dhatu Vaishamya is anatomically and physiologically and nutritionally also. Then we can add the postural analysis app so that we can see the Samyata in body posture also. So, is there any like scoliotic conditions or the pelvic tilt or the shoulder drop? Some of the common cases you can find in your daily practice. Then imaging and enhancement through AI. So conventional X-ray, MRI, CT scan. Then we can collaborate with the Dhatu Vichar in Ayurveda. For example, if we are seeing the X-ray of the spinal lumbar spine, then we can collaborate it with the like asti with the vertebrae and tendons or the snayu. Then the most common finding is facetal atrophy in the MRI in the aged patients. So what is it's nothing but a shushkata in the snayu. So we have to oilate it, or we have to do the bruhan of the snayu. Then Rachnatmak Dhatu Samya, that is anatomical alignment, we can see in the X-rays. So we can take the help of this. Nowadays, X-ray analysis or X-ray analysis in posture have got the AI assistance also. There are some apps which can be applied on X-ray and MRIs, which will give you the exact condition or the anatomical alignments. In the sports medicine, the most recent trending topic is the prehab rather than the rehabilitation. Now, sports industry is focusing on the prehab, and believe me that Ayurveda people are best in that. The prehab, because we can predict with the Prakriti Parikshan that what medical issues or what physical issues that a particular athlete or a particular patient can have in future. So we just need to document it. We just need to document it through AI so that we can build a strong protocols for diagnosis. Then again coming to the risk assessment for the patient. So Sharir Prakriti is again a great tool. Then I will also add the Manas Prakriti also, because it plays a vital role in pain management and any physical disorder. Then Ahar Hetu, that is nutritional assessment, we are best in giving the tailor-made diet based on the Desh Dhatu, sorry, on the basis of the different deshas, that we can tailor-made the diet, like somebody in Kerala, how should be his diet, somebody in Maharashtra, in Nagpur should be, somebody in extreme cold like Kashmir. So we can tailor-made the nutritional assessment and we can do, and believe me, we are the best. Then the Vihar Hetu, nowadays a big challenge, that is the lifestyle and professional hazards. In that we can teach just like in introduction, said that madam has integrated it into the Android app. So we can integrate. I have also my own Android app of my clinic, from where I will send some of the uh, tips to the patient. Like if you are sitting for 8 hours, 10 hours, so you can use your mobile or your wearable gadgets to remind you to move. That is the activity tracker is there, or the uh, uh, not activity. If you are sitting for more than half hour at a one place, then it will vibrate automatically and will remind you to move and get some stretches done. So it will also this kind of AI integration with the Ayurveda lifestyle we need to add. Then AI driven treatment, we can also take the help, like now just like in Nadi Pariksha, there are lots of devices and lots of uh, app applications are coming nowadays, which help in ready-made report. They just you just do the Nadi assessment with that device, and it will give you the complete Prakruti Parikshan or complete assessment. So on that basis, we can it will be able for us to we can personalize the treatment. So AI can analyze the patient-specific data to create the personalized treatment plans, ensuring tailored approaches that consider individual patient needs and the improving overall outcomes. So with the help of AI, because patient is not 24 hours with us, so with the help of AI, we can track all these things, that how much water he is intaking, how is his diet, how he has moved, how many steps he has walked, and all that tracking of the patient we can keep with us to tailor made his treatment needs. Then monitoring the progress, we can also monitor the progress through wearable devices and AI algorithms. Continuous monitoring to patient progress is achievable, allowing the timely adjustment to treatment plans based on the real-time data. So we should take the help of this also. Then management and improvement. Again, we can find some flaws and cons in the patient's lifestyle or our medicines, or for our data keeping, we can use these all AI tools which will help us and our patients to take better care of themselves, and we can make the good strategies, and we can also focus on the outcomes of the treatment. Then what should be the, in short, what should be the clinical protocol in integration, that we can integrate AI and Ayurveda in diagnosis and assessment, then in Ayurveda treatments and use of modern tools. So if with the help of these three things, we can create the clinical protocols for our patients and to us also. So these are some things which I have to show, that this is the postural analysis with the AI postural app. So here you can see that it is showing you the actual postural deformity in the patient, and it will tell you, for example, we will take this, that this is the Q angle of this patient is 12.95 of the knee, and here it 8.35. So Q angle of the right leg is more. So it is coming from the hip. So though patient come to you for the knee pain, but we have to treat his hip also. So this kind of information you can take with the help of AI. Then we can also track, as I have said, there are nutritional apps, or we have the devices like that, where we can calculate the BMI, body mass index, and we can track the BMI and all BMR or all other vitals which are necessary. So you can we can integrate these types of diagnostic tools. That, as I have said, that how we can combine the Ayurveda diagnosis with the AI tools. So you can see that this patient, from the seeing from the lateral side, this patient's angle from shoulder to neck has been decreased, and therefore the patient have the hyperlordotic curve, and he will develop ultimately he will develop the low back pain. So we can educate the patient with this help of these graphs, with this integration of AI, that you are standing wrongly and you should stand correctly, so that your low back pain will not come again and again. Then this is the actual treatment collaboration, as all are Ayurveda Vaidyas and all are the teachers. So I will not go into the Ayurveda treatment. I am coming directly to the treatment with AI. So as you can see, myself treating a patient, this is called as a flexion distraction table. This was actually developed by Dr. Cox in USA, and there have extensive research has been done on this. So first I will play the procedure. So you can see that I have distracted, I have locked the patient with this belt, thoracic spine, and I have locked his ankle with these belts, and I have distracted. Now I am distracting it as the patient is of a unilateral symptoms with neurodeficient, sciatica, which we commonly say. And here I have anchored the vertebra because the patient was having the compression in L5S1. So I have anchored the L5 here. I will play it once again. Anchored the L5 and give distraction to the L5S1 disc, and then I am doing the flexion and distraction, and the flexion and distraction only up to 5 to 6 degree, because it is the segmental mobility. Though we can bend forward up to 90 degree, but if you see for the segmental mobility of each segment or vertebral segment like L5S1, the maximum segmental mobility is 7 to 8 degree, and that only I am doing. So now how we are tracking with the AI. So here on the left side of your screen, you can see that this is the screen which I am continuously seeing in on this panel. So this is the video of that panel. So here you can see that this is the distraction force. The formula for it is that the distraction force should be half of the body weight of the patient. So the patient's weight is around 78-79 kg. So I have given the distraction force of up to 40 kg. And you can see that as I am moving, both the videos can't be played, but as I was flexing, the distraction force was reducing. So it is, and here is the flexion degree which I am applying. Here you can see up to 6 degree I have reduced and decreased. I have flexed up to 6 degree, 6 to 7 degrees and reduced. This graph is showing that how the pressure is putting and releasing from the, so this is the maximum pressure. This is the maximum pressure and this is the minimum pressure when decompressed. So this is how we use the AI. And before doing this, we have done the proper Snehan Swedan, proper Katipasti of the patient, so that the resistance from the adjoining muscles, the paraspinal muscles, the deep paraspinal muscles, the ligaments, tendons should get relaxed because of the Snehan Swedan. And after that, I am integrating this, and it, believe me, doing it alone and doing it with the integration of Ayurveda, the results or the outcomes are far different or far better. And for this, I will show you the real results of the patient. So you can see that this is a 40-year male patient. This was on the left side. You can see that this is the compression where you can see that there is are osteophytes. There is the reduction of the space. Also, you can, when you can see the neural foramen, there is no space in neural foramen, and the patient was having the severe sciatica pain. After the treatment, the neural foramen got opened, the disc space has been restored, and this is what not only I am saying, but you can see the printed report from the radiologist that the anterior posterior marginal osteophytes are seen. There is a reduction in L5S1 intervertebral disc space and improved as compared to previous X-ray dated 23/4. So in the first sitting of the patient or the first day of the treatment was 15th August 2024, absolutely 1 year back, and the outcome come into the 23 the first treatment was 23 March, April, 23rd April, and in August patient got decompressed. So that time has been taken, but the patient was advised immediate decompression surgery. So we have avoided this surgery. I am taking different cases. Then you can see that this is one of the toughest case I have treated in the cord compression or the AP diameter of the cord was only 4 mm in MRI. I don't get the MRI, so I don't put here. But the patient has been already convinced to get operated. But he came to me with the words, डॉक्टर साहब मैं एक आखिरी बार आपकी ट्रीटमेंट लेके देखना चाहता हूँ. मैंने बहुत ट्रीटमेंट लेके देखी है, आपका नाम सुना है, मैं आखिरी बार आपसे ट्रीटमेंट लेना चाहता हूँ. अगर नहीं हुआ तो मैं ऑपरेट कर लूंगा. So I said that okay, it is the toughest job to treat the 4 mm because it can land up into the cauda equina syndrome and it may be a severe neurodeficient. So you can see that in above X-ray, the spine is already straight. The disc space is reduced. And after the treatment of around 1.5 months, you can see that the lumbar lordosis has restored. Already the lumbar lordosis has restored. And again, not by me only, or I am not claiming it, but the evidence is speaking it, that the anterior posterior marginal osteophytes are there, but previously seen reduction in L5 S1 intervertebral disc space increase as compared to previous X-ray dated 18/3/24. So the previous dated X-ray was 18/3/24 and this X-ray was taken on 28/4/25. These are some recent cases. You can see that. Then this is a something different case with more challenging. You can see the X-ray, you can see the scoliosis. The patient is of 73-year-old. I am also showing the first case we have seen is of the 40-year-old. The second patient we have seen is of the 60-year-old patient. And this is the 73-year female patient. You can see the X-ray above and you can compare the X-ray, the visual difference you can see. And what is the difference in this case? That it is the case of anterior listhesis. It's the because with the unstable listhesis, this case was of unstable listhesis patient have no balance in walking. There was a severe numbness, neuro-deficient was seen, and as the patient was diabetic also, so no surgeon were avoiding to do this surgery because of her medical health conditions. And we took the challenge, and the first time patient came to me in December 2024, in 30 December 2024, and we treated it for 3 months. In 21-24, we found this result that there is a reduction in L2, L4 intervertebral disc space. Improvement is seen in disc space L5, S1 vertebral. Rest disc spaces are normal. So the listhesis has been restored. The disc space has been restored, and believe me that auntie was coming from 100 kilometers from my place and she came by driving. So it was a great pleasure to treat such cases, and that is the power of integrating Ayurveda with AI. Then coming to the cervical cases, we have all the 3 cases I have seen. This was a VIP patient, that's why you can clearly see the difference between these first X-ray. You can see the disc spaces or the vertebral column is how much it is intact, how much it has no space. You can barely see the neurological or the nerve. Sorry. So you cannot see the foramen, neural foramens. So you cannot see the neural foramens, barely you can see the neural foramens, but in this X-ray after the treatment you can see clearly the intervertebral spaces differently. The patient was landing into the severe headache, severe tension headache, then it was unstable gait, was having severe vertigos, like every time he changes his posture from sitting to standing or from supine to sitting, every time he got the vertigo. All the symptoms were released, and the treatment again come into the first X-ray is of 17th May, and the next one was in the 11th June. So you can see roughly in 4 weeks the patient has been restored. Also you can see that there is a large amount of scoliosis. The scoliosis also been reduced. These are the visual changes you can see. Here is a 15-year-old, sorry, yes, 14, 15-year-old boy with the scoliosis. The scoliosis was developed after his knock knee surgery. So here you can't see the major changes, but I will show you, then we'll be able to find the, here you can see that he has a shoulder drop. Then the patient's treatment is going on still. His shoulders are misaligned. His scapulas are misaligned. In this, you can see that the shoulders are aligned, his scapula are aligned. Then the difference between these both hands had been reduced. You can see that. But unfortunately, the child's limb length has been changed. So he has to use the orthotics to correct that. But the symptoms and the functionality has been considerably improved in this case. And here he is a 85-year-old uncle. In this picture, you can clearly see visually the scoliotic curve in the before picture at the lumbar, and here you can see the straight. You can see also he has the kyphotic hyperkyphosis. That kyphosis also reduced. That's why his skin wrinkles can be seen on the both the sides equal. Here you can see only on the right side. The skin wrinkles are on the right side because of kyphosis, the skin has been stretched. And after treatment, you can see the posture has been corrected considerably. The neurological symptoms had been reduced significantly. So these are the cases. These are the integrations which we are practicing at our place. So the ancient wisdom of Ayurveda meets the modern technologies, manual therapies and technologies at our Ayurprabha Spine Care. I would thanks to all the dignitaries on the panel, all the organizers, all my gurus and Bhagwan Dhanvantari to give me that this opportunity, this wonderful opportunity on this great platform. I thanks all the co-chairpersons and the chairpersons for being there with these sessions. Thank you, ma'am. Over to you.
Thank you very much, Dr. Swapnil sir. It was a really informative session, and the pictures and the X-rays before after that you had shown will definitely inculcate a confidence in our future doctors. Thank you so much, sir. So now the session is open for question and answers. Over to you, Nanesh sir.
Yes, thank you, ma'am.
So till the other participants put the questions in the chat box, we will move forward to the remarks. So I asked Dr. Om Prakash Dave sir, who is the co-chairman for this session. So please give your remarks or regards regarding the session.
Thank you, Dr. Nirmala Madam. So on behalf of everyone present, I sincerely thank our esteemed guest speaker, Dr. Swapnil Avinash Gawande, sir, for such a enlightening and thoughtful
Sir,
program.
your voice is not coming properly. Please connect properly, audience.
Now I am audible.
Sir, maybe multiple devices are connected near you, so that is why the echo is coming.
Madam, please, can you read on behalf of me?
Now, sir, the echo has gone, sir. You can continue, sir.
Oh, thank you, ma'am. On behalf of everyone present here, I sincerely thank our esteemed guest speaker, Dr. Gawande, sir, for such an enlightening and thoughtful provoking presentation on this unique subject. Dr. Swapnil sir's deep expertise in Ayurveda, especially in spine injuries management, is really very unique, and the presentation was with very clarity and passion with which you shared knowledge has really inspired everyone. The way you connected ancient wisdom with presently is remarkable. Relevance was remarkable and has given us perspective to carry forward. Your efforts, sir, Gawande sir, your efforts in preserving and propagating Ayurveda in this subject across generations are commendable. And today's session has reminded us of the timeless value of the science for holistic health well-being. We are grateful for your valuable time, your dedication, and the wisdom you shared. This will surely guide us in our professional and personal journeys. Thanks you once again for enriching our minds and hearts with the essence of Ayurveda. And I thanks
Thank you
to
for your
ATACON
blessings,
for
sir.
arranging such conferences. Thank you, sir. Thank you.
Thank you for your
Thank
blessings,
you,
sir.
madam. Thank you. Thank you.
Thank you very much, Dave sir. So before moving
Thank
to
you,
the
madam. Thank
remarks,
you.
before moving to the remarks by Preeti madam, we'll just take some questions which are there in the chat box. So, Swapnil sir, somebody is asking that if there is a
Wow.
patient on wheelchair due to spine injury, is there any chances to recover?
I'm with due respect to the question, but I would like to say that, as I have said, that the analysis is the core thing. So I cannot give this a straight answer, yes or no, because I have to examine the patient. I have to see his condition, what is actually the condition, what actually the thing, or what is the actually diagnosis, why the patient is on wheelchair. So after that, maybe I can comment on it.
Definitely, sir. So, sir, another question by Dr. Deepali Bhoite is there any Ayurvedic treatment available for TB spine?
Yeah, definitely. Rajeshma treatment explained in Ayurveda is you can do it for the spine TB also, for pot spine also it is the same. But this flexion, if you are asking particularly about this flexion technique, then you cannot do in pot spine. It's a red flag for pot spine.
Thank you, sir. Last question we will take for today is, sir, what is your experience with lumbar stenosis? This is
All
asked by
the
Dr.
cases.
Shivani Dubey.
Yes,
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 sir.
yes, Dr. Shivani. All the lumbar cases which I have presented with the X-ray, they all are of the spinal stenosis only. And I have just shared my experience with the spinal stenosis.
Yes, thank you so much, sir. So moving forward, we would like to have remarks from Dr. Preeti Tambat ma'am. Dr. Preeti ma'am, over to you, ma'am.
सभी को नमस्कार। डॉक्टर स्वप्निल गावंडे जी का आयुर्वेद और आधुनिक मशीन का संगम, आयुर्वेद पंचकर्म थेरेपी, आयुर्वेदिक डायग्नोसिस और आयुर्वेदिक कंसेप्ट्स, इसके ऊपर का विश्वास, आधुनिक मशीन का उसके साथ का संगम, यह आपका आयुर्वेद के प्रति प्रचंड विश्वास और टेक्नोलॉजी की माइन्यूट समझ को दर्शाता है। सो बहुत बहुत धन्यवाद, बहुत बहुत बधाई आपको। आप ऐसे ही आगे चलते रहे, आयुर्वेद की जगत को एक नई प्रेरणा देते हुए। अटैकॉन को भी धन्यवाद देती हूँ और स्वप्निल गावंडे जी को आगे की प्रवास के लिए, आगे की यात्रा के लिए बहुत सारी बधाई देती हूँ।
बहुत बहुत शुक्रिया।
बहुत सुंदर।